Hi, Dr. D here. Today we're going to talk about patient concerns, and if you're watching this video, a friend or family member probably told you to, so you can get more information on whether you should become a chiropractic patient or not. A lot of people have common concerns, and I'm going to go over and address the majority of those in this video, we hope. First of all, are chiropractors real doctors? Well, the answer to that is absolutely we're real doctors. We're doctors of chiropractic care. We have 8 years of education that is the same amount of education that the medical doctor has. The difference is we focus more on nutrition, x-ray, and biomechanics, where the medical doctor focuses more on pharmacotoxicology and disease processes. Now, with that being said, we're a real doctor. And what does chiropractic mean then? Well, chiropractic means healing by the hands. These are our instruments. This is what we use to work on you. It's interesting, we're actually a doctor that will touch you. People find that quite unique because a lot of doctors never even, most patients come in and go, the doctor never even touched me. So chiropractic means healing by the hands. Now, what does an adjustment do? That's one of the biggest questions that most people do, and there's a reason why a lot of medical doctors haven't referred to us is because they don't know what it does, because they haven't taken the time to get educated. Here's what a chiropractic adjustment does. First of all, we need to understand a term. Subluxation. Subluxation means that these vertebrae are not functioning in all of the ranges of motion and movement patterns that they should be. So this vertebrae could be fixated and it's not moving well. When that vertebrae is not moving well, it affects the discs, it affects the nerves, it affects the muscles around that vertebrae, and it's going to alter function. It will in turn eventually create inflammation and pain. If you take your wrist and you twist it and you hold it there, it's not a big deal. But if I hold my wrist like this for an hour or 2 hours, it's going to be really sore. Well, imagine if you had a vertebrae that was being held out of position for a long period of time. That is essentially what a subluxation is. Now, sometimes it's not just out of position. It could be that it's been injured from a slip or a fall, or something you did from a football injury years ago, or a car injury or whiplash. So what a chiropractic adjustment does is we go in with our hands and we will adjust the vertebrae with a quick thrust that doesn't hurt and restore proper function and movement. Restore the balance between the nervous system, the muscular system, and the skeletal system. Now, it creates a popping sound, which people are like, oh, I don't want my back cracked. We don't either. We don't crack your back, we adjust your spine. The popping sound is simply a gas being released in the joint. If I pop my knuckles, that releases gas in the joint. 20 minutes from now, that will repressurize. I can make that same sound. That doesn't mean I'm adjusting them. That's just a byproduct. Now, the neat thing about our office is we have many techniques to work on the subluxation. This is an impulse device. This is an $800 computerized adjusting instrument that keeps the spine in neutral and will improve function and restore natural movement to that spinal subluxation. We also have techniques that are tractioning techniques that will open and close the joint for disc injuries. We have drop table techniques. So a lot of the adjustments that we do don't make a sound at all, which is fantastic. Now, the thing that you're also wondering about is it safe? This is one of people's biggest concerns. I'm going to talk to you logically, not emotionally, because people are emotional about things they don't know. So let's educate you. First of all, malpractice. A medical doctor's malpractice insurance in Connecticut is around, an internist is $11,000 to $20,000 depending on their policy. A naturopath who just deals with vitamins is $15,000. How do I know that? I asked a friend of mine. A surgeon, common surgeon, will be anywhere from $40,000 to $80,000. OBGYNs in Connecticut are over $100,000 to $120,000 for malpractice insurance. Now, with that being said, what do you think a chiropractor's malpractice insurance is? Well, here is my malpractice insurance fee right here. If you look as we zoom in on that number, it's $2,200. So what that tells you is it is not dangerous with what we do. Insurance actuaries know where there's risk. And if there was a risk at what we did, that number would be much higher, wouldn't it? So let's take the emotion out. Logically, it's the safest, most effective natural treatment you can get to restore function in your body. Now, what about one of the other myths? Well, I don't want to go to chiropractic because once I start going, I always have to go. I've heard that. Well, that's like saying, I'm not going to brush my teeth because once I start brushing them, I always got to do it. Or if you go to the gym, when you get in shape and you've been working out, if you stop exercising, what happens? Your body starts atrophying and you start getting out of shape again. We are not a maintenance-free system. We have been taught to be a maintenance-free system by people that push pharmaceuticals because they want you to take the pills. We want to teach you how to maintain your body so you don't need the pills. With that being said, what about the fact that if you've had surgery, should you come in? So a lot of people go, well, I've had surgery, I can't come in. We worked with some of the top spinal surgeons in the area for pre- and post-surgical treatment. Dr. Hutter and I have referrals from all the surgeons in the region. Why? Because our office is so unique and effective with dealing with disc injuries. Most surgeries for the spine are disc injuries. We always work above and below a surgical area, but at times there may be scar tissue that we work on as well. So that can help. And so if you've had surgery, you're actually a great chiropractic candidate because we want to work the spine and make sure the spine stays healthy above the surgical area so you don't have to have another surgery. Now, how long does care take? It's a good question. It really depends on you. I had a person that just came in this week and he's had the problem for 15 years. So that's not going to go away in a week. You know, typical care patterns are 90 days. You start out with more treatment in the beginning because we're trying to change and restore function. And then we decrease care and put more care onto you. You got to do more homework on the second month and then on the third month. And our care dwindles down. Then the maintenance is up to you. We have a lot of people that come in once a month, once every 2 weeks, once every 2 months for care. But it's their choice. They don't have to come in. They know that they live at a healthier level when they do. So those are a bunch of the concerns that people have. I hope that makes you feel a little more safe about putting chiropractic into your health care. I hope we'll see you soon. And if you have any more questions, feel free to give our office a call. And this is Dr. D talking to you, signing off, and I'll talk to you on the next video.